100 Empire today.
At the first mention of dentures, most people immediately picture someone who's a bit older, maybe like your grandparents or your older aunt or uncle, and oftentimes you'd be right. However, the need for dentures is becoming more common among younger patients. Joining me with answers about dentures and your dental health is Dr. Murali Lakireddy with Aspen Dental. Doctor, it's a pleasure to have you here.
Oh, thanks for having me.
Typically, we mentioned that dentures are for older folks, and they can cause some problems for people. What are some of the common problems that people are experiencing when they have dentures, doctor?
Well, the most common typical problem is like if fitting denture, they have trouble chewing with it right there. They have sores like from the denture. It's painful from the sores. Those are the typical problems. And also, if they're new denture wearers, they have problem getting used to the dentures right there. Those are some common problems patients experience with the denture.
As people get older, they have different type of dental and oral health problems. So what should older folks really keep in mind if they want to try to keep their teeth and avoid getting dentures?
Exactly. Older patients have a unique problem right there due to the medications that they're on right there. They tend to cause dry mouth, and that tend to lead to further decay. That's the most common problem right there. And also, most people using dentures, especially if they're ill-fitting, they cannot chew properly, and their nutrition get affected right there. That can lead to more problems right there.
We're talking about older adults, but really more and more younger people are having to resort to dentures, true, and are you seeing that in your practice?
Yes, we are. There are roughly about 35 million edentulous patients in the United States.
Really? I didn't know it was that high.
Yes, and about 15% of United States population get new dentures like every year. So they're all different kind of population among them right there, and that's where we're seeing denture patients everywhere right there.
Mm-hmm.
Yeah.
There are new technologies, though, with dentures, improved technologies. What are the good things that people know if they do have to get dentures that maybe help them fit better or feel better?
Yes, like there are many different newer materials and newer methods. At Aspen, we have in-house lab right here, and the machines are more compacted now, where we can accommodate in the dental office right there and provide dentures like right away as soon as possible with a much better quality.
And the fit is better now too, doctor? Do you find that as well?
Definitely, like the fit is much better as we don't have to take the impression and send it to outside laboratory. We're actually doing in-house. We have a lab tech at hand, like so that actually helps, makes a big difference.
Mm-hmm. They can check right there and then if that's a good fit.
Exactly.
And does a good fit give that patient more comfort and confidence?
Definitely, like it's not easy to get used to dentures. Like there is.
They're not your real teeth.
They're not your real teeth. Like there is like initial adjustment to the dentures.
Mm-hmm.
Like patient have to, their lips, their mouth, their tongue, everything has to get used to dentures right there, which is going to take time right there. And we're here to help through the process right there. And if their dentures are not fitting well, they should go back and contact the dentist right there, and we're here to help through that right there. Well,
I understand that you sort of have a money-back guarantee for folks when it comes to dentures. You really want to make sure that they fit and that they feel good when they leave.
Exactly. As we just discussed, like dentures are not easy to get used to, and we try everything to make it comfortable for them. Even after that, if they're not satisfied with their denture, we are ready to actually offer the money back. Provided that the only exception is we ask them to bring the denture back in 90 days right there.
And as always, if we really do take care of our teeth and gums, hopefully won't lead to that. So brushing important, I assume, floss, all those things?
Yes. We recommend brush at least minimum twice a day right there, and floss twice a day to remove the food particles that's in between the teeth right there. And also, it's more than twice a day whenever you drink like coffee, which stains your teeth right there. When you do that, like I recommend brushing like right away so you're not causing more problem for yourself.
Good advice, doctor. Thank you so much. And interesting stuff about the dentures too. Nice to talk with you.
Thank you.
Well, today may not be the ideal spring day, but we are heading for weather, so be ready with the fresh makeup looks for spring, and that's next on Daytime.